My name is Zajic. I am a 6-year cervical cancer survivor. I have a husband named Dean and 3 little girls named Katie, Clara, and Julia. I was diagnosed in August 2016 with stage 1B2 cervical cancer. Within that time, my oldest daughter was 3 years old and my twins were 9 months old. I had treatment consisting of chemotherapy, external beam radiation therapy, and brachytherapy, which is an internal radiation. The treatment lasted about 8 weeks, and I continue to have long-lasting side effects as a result. I have been going through some GI issues, bladder issues, osteopenia, just to name a few. But also within that time and thereafter, I have suffered severe depression as well as health anxiety, given my health and my family's health. The HPV vaccine is cancer prevention. It can prevent 6 different kinds of cancer, including cervical cancer. Cervical cancer can be prevented. These 5 other kinds of cancer can be prevented, and it is important for young children ages 9 up to age 45 to obtain that HPV vaccine. No one should have to go through what I went through.
I'm Dr. Michael Shull. I'm a pediatrician. I've had the privilege of taking care of kids in Southwest Kansas since 1988. I'm old enough and have been practicing long enough that when I started, we actually did pap smears in the office on adolescents. We don't do that a lot anymore. The reason I mention it is because I've actually seen teenagers with cervical changes that I've had to refer to gynecology for carcinoma in situ or other cervical changes. These changes were caused by human papillomavirus. The disease is there. There's no reason we should be afraid of a vaccine that can prevent cancer in our kids. We see a lot about vaccine reluctance. I think part of the reason people are starting to accept vaccine reluctance is they're not old enough to have seen the diseases we're trying to prevent. I'm old enough to have seen polio. I'm old enough to have seen Haemophilus influenza B meningitis, what the Hib vaccine prevents. When I was training, I had dozens of kids a year in the hospital with Hib. My oldest son was 5 years old when the Hib vaccine came out, and I've gone from seeing dozens and dozens of cases a year of meningitis to almost none. Pediatric residents these days hear about it historically, but don't see the meningitis I saw growing up. Rotavirus vaccine prevents diarrhea in babies. Everyone knows about cruise ship diarrhea, the norovirus. But almost nobody knows about rotavirus anymore because their infants are getting rotavirus vaccinations, and we're not hospitalizing dozens of kids every winter with dehydration because of diarrhea. It used to be so common when I would put a baby in the hospital, the nurse would change the first diaper and say, "Oh, Dr. Shull, it's rotavirus." Those nurses don't see that anymore, and they can't diagnose us like that anymore. And fortunately, we don't see babies in the hospital because of rotavirus. So parents of school-aged kids need to recognize these diseases are real, these illnesses are real, and their children are being protected by these vaccines.